All right, we're ready to start. Welcome, everybody. Good afternoon. My name is Linda Hughes. I'm the chair of Alberta Health Services Board, and I'm happy to welcome you to our April Public Board meeting. Today's meeting falls during National Volunteer Week in Canada. This week is an opportunity to celebrate volunteers and the power of volunteerism in our communities. At Alberta Health Services, we have more than 13,000 volunteers who generously dedicate nearly 1 million hours every year to improving the experience of our patients. We couldn't do what we do at AHS without the tireless efforts of these community-minded volunteers who help us with a wide range of skills depending on their interests and their experiences. We have volunteers who greet visitors and give them directions. We have volunteers who provide comfort, companionship to patients and families as they cope with stressful times in their lives. We have volunteers who cuddle newborns and knit them caps to keep them warm. We have volunteers who drive patients to medical appointments, volunteers who support our teams, our research, and our fundraising. To all of those volunteers, I'd like to say thank you on behalf of the AHS board and our leadership team and the site teams across the province. We're incredibly grateful for all that you do for us. As an organization, we want to ensure our volunteers enjoy their work and feel recognized and valued as members of our health teams. Recently, several of our senior leaders spent time job shadowing volunteers to gain a better understanding and appreciation for their work. We call the initiative Volunteer Buddies, and we created a short video that captures some of the job shadowing that's happened in the last few weeks. I hope you enjoy it.
Good morning, Brenda. I'm Barb.
Hi, Barb.
Nice to meet you.
It's nice to meet you as well.
This should be interesting.
You know what? I'm really looking forward to today. I would like to learn more about how you help people that come into our facilities.
Some days when she's cuddling with a child that's sick in bed, her paw will come up, or I call it her arm, but she'll cuddle them. Yeah, good girl. Some days we've had where a child might not take their medicine, so they've filled this with water and then put it in the dog's mouth. The dog takes the medicine, then the child will take the medicine.
Thank you again for doing this. What a big difference.
You're welcome.
Yeah.
Well, I certainly enjoyed getting to meet Shakib.
I enjoyed getting to show up with you.
The role is really indispensable when you think of the value that they bring to Alberta Health Services, whether it is holding babies in the NICU or meeting people in our emergency departments. They make a difference every day in different ways and in everyone's journey through our facilities.
I lost my husband a little over a year ago, and this is my lifesaver now. I love what I do. It's the best thing ever.
I'm like the Walmart greeter.
Okay, all right.
Can I help you?
Right.
That's my words.
Nice.
As soon as I come in, can I help you? And I make sure that they're in a place where they can be triaged. I've been asked to give people sandwiches, give people a cup of tea or that kind of thing. I can do that. I have people say, what are the hours here? I say, well, 24/7. Really? Yes, it's open all the time.
Thank you.
Yeah, well, hey, yeah, you bet.
Well, thank you. That was great. It's nice to see how much volunteers love what they do. I gather the job shadowing is going to continue for the next few months, so you can keep an eye out for that. I'd like to thank everyone, all the leaders who went out and did that. Verna, you look very lovely in there patting the dog. That was great. And most importantly, thank you again to all our volunteers for all that you do. Now moving on to today's agenda, we're going to hear today from the Audit and Risk Committee, the Finance Committee, and the Community Engagement Committee, which is seeking approval to create a new provincial advisory council focused on seniors and continuing care. Before that, we'll hear from our President and CEO, Dr. Verna Yu. But before I turn the mic over to Verna, I'd like to get approval for the agenda. Does everyone have a copy? Could somebody move approval? David, seconder, Hugh, all in favor? Thank you for that. Declaration of conflict of interest. Does anybody have a conflict of interest they'd like to declare? No, hearing none. And finally, the minutes from our March 29th meeting. Linda, you would move them? Marlis, second them? All in favor? Great. Thank you very much. So with that, I would pass it over to Verna.
Great. Thank you, Linda, and welcome everyone to our public board meeting. Today, as we near the end of April, Alberta Health Services is marking two important anniversaries. Both anniversaries show how far we've come as a healthcare organization. To start, consider this. On this date last year, Albertans had no inkling of the crisis that our province would face in less than a week's time. Wednesday marks the first anniversary of the Fort McMurray wildfire evacuation. And many of our staff, physicians, and volunteers will gather that day at Northern Lights Regional Health Centre to mark the occasion and remember the remarkable events of May the 3rd, 2016. This will be a good opportunity for them, and really for all Albertans, to remember their heroic actions as they safely evacuated a hospital in less than 2 hours and ensured patients and clients were transported to safety. The immediate response to Fort McMurray wildfire was one of the biggest challenges that we faced as an organization and as a province. And I'm incredibly proud of our people across Alberta who, in a very stressful and volatile situation, did everything possible to ease the burden of 90,000 displaced residents and to provide comfort, compassion, and life-saving continuity of care to patients, clients, and families. AHS showed its resiliency during this disaster, and just 1 month after the Northern Lights Regional Health Centre was evacuated, the facility had been restored and reopened following weeks of around-the-clock work by our staff and contracted partners. The wildfire has long been extinguished, yet AHS is still working to support the people of Wood Buffalo as they try to deal with the emotional toll of this tragedy, including many AHS staff, physicians, and volunteers. Recovery takes time, and it takes continuous attention. Thousands of people experienced the wildfire, and every person had his or her unique story of the challenges and fears that they faced and overcame. Similarly, the path to recovery is going to look different for each individual. But rest assured, just as AHS was there for Wood Buffalo residents on May the 3rd, 2016, and in the days and weeks that followed, we continue to stand by them and support them as they put their lives back together. I'd like to salute the fortitude and tremendous heart shown by AHS staff, physicians, and volunteers across the province as they responded to the disaster as it unfolded, as well as for providing continued long-term support to Albertans affected by the wildfire. I'm very grateful and I'm humbled by their dedication. I encourage you to visit the www.ahs.ca/oneyearlater to see a special 1 year later webpage devoted to the ongoing Fort McMurray wildfire response. This month also marks a half-year anniversary. 1 year ago this month, the Community Engagement Committee of the Board held its inaugural meeting, and I cannot overstate the significance and importance of what has followed. The committee was established to provide governance leadership to AHS community engagement activities. And with the committee's leadership and oversight, our organization has a renewed focus and commitment to proactively consulting with Albertans regarding decisions that affect them. Over the last year, our AHS leaders and community engagement teams have met with Albertans in all parts of the province to talk about their healthcare needs and concerns. And more we're meeting with communities early before their concerns turns into crises. Oftentimes these meetings in communities such as Beaver Lodge and Sundre and Sylvan Lake have led to changes in healthcare delivery that directly addresses issues raised by people who live in those communities. AHS wants Albertans to know that we are listening and that we care. AHS also launched long-range planning initiatives in the Calgary and Central zones to supplement similar work now ongoing in Edmonton, with South and North zones next to follow. Through face-to-face sessions, as well as through online input, long-range planning is giving Albertans the information they need to help shape what healthcare delivery will look like over the next 15 years. The committees have been involved in connecting with our foundations and working in true partnerships with AHS 69 foundations and trusts to celebrate and encourage philanthropy. AHS is a person-centered organization, and as such, we need to listen to the people we serve. And I think for the past year, we've been doing a much better job of doing that. Part of the renewed focus on the proactive community engagement involved revitalizing our health advisory councils, provincial advisory councils, and the Indigenous Wisdom Council. We've done this by recruiting more than 80 new members for these councils and revising guidelines to ensure their work is both meaningful and strategic. I'd like to show you a video that explains the unique mandates of our health, provincial, and Indigenous Wisdom Councils and introduces you to some of the people who volunteer their time to sit on these councils and work with AHS to build a better healthcare system.
Wisdom Council is set up with a group of elders from across the province, professional people, young and old. We have medical doctors as well. We come together and really bring in the concerns of the Indigenous communities, looking at what is service delivery like. You know, we're looking at disparity of services. All Albertans deserve quality health care, and we're trying to bring that up to par with Indigenous communities.
It's nice because we have what we'd like to think is a balance of the voices of Albertans within our council. We look through the whole continuum of care for cancer, and we try to come up with ways to improve what's already going on, but also ways to advise government on where their resources would best be placed.
And we listen to individuals in the community and their thoughts on the healthcare system and what they feel like needs to be improved. We try to find strategies or initiatives that we can create in order to implement those changes in the system and basically act as a communication feedback channel between individuals in the community and Alberta Health Services.
Alberta Health Services has really revitalized community engagement. One of the first things that the board did when it was formed just over 18 months ago was to form a community engagement committee. Since the fall, there's been a recruitment of 80 new members to the advisory councils. So really looking to them to hear the voices of the Albertans. And they do that in a variety of different ways, through meetings, through engagement activities, through long-range planning. So they're really working together to hear the voice of Albertans in the delivery of healthcare across the province.
Everyone has something that they want to change in our healthcare system, but they don't really necessarily take the steps to make those changes. So I often find people coming to me, they know I'm on the council, so they tend to tell me they know that their members can make a difference.
We all feel very passionate about cancer control in Alberta, and I think our passion working together has actually helped forwarded a number of agendas. The Calgary Cancer Centre, we're very eloquent, I think, in promoting the needs of that centre. I think the biggest thing we've done is we got colon cancer screening going in a big way in Alberta.
We're seeing some of our results that recommendations that we put forward that are being acted upon. The traditional medicines is being acted upon, midwifery is being acted upon. We're seeing changes we're seeing that there's that level of understanding AHS is actually doing. I think that's the biggest one for me, that our voice counts and that's being heard.
The Alberta Health Services Board and Alberta Health Services leadership are very grateful for all the work that these volunteers do on the advisory councils.
So as you can see, our advisory councils play a crucial role in helping our provincial-wide health system be responsive to the needs of the populations and communities, big and small, and in all parts of the province. I'd like to thank the 188 volunteer members of our advisory councils who collectively devote thousands of hours every year to ensure AHS makes the best decisions possible for the people of this province. I'd also like to thank board members Dr. Brenda Hemmelgarn and Marlis Taylor for their continued support and contributions to the AHS community engagement efforts. Brenda and Marlis not only provide leadership on the Community Engagement Committee, but they have given generously of their time to attend events such as meetings of advisory committee chairs and long-range planning sessions. I want to also thank Colleen Turner, who's our VP for Communications and Community Engagement, who's been a tremendous leader for us. I mentioned earlier that the community engagement and wildfire anniversaries show how far we've come as a healthcare organization, and today we remain steadfastly focused on helping people cope with the physical and emotional toll of the Fort McMurray wildfire. We also remain steadfastly focused on reaching out to Albertans, listening to what they have to say and ensuring their ideas and preferences are considered when decisions are made. So yes, we are marking 2 important anniversaries this month, yet we also know we have a lot of work ahead of us. So thank you for your time today and for your commitment to Alberta Health Services.
Thank you, Verna. All right, moving along now. We're going to look at the Audit and Risk Committee. David?
Thanks, Madam Chair. Again, I apologize for inadvertently unplugging your microphone earlier. The Audit and Risk Committee met on April. The Audit and Risk Committee met on April 12th. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. The committee received an update on the preparation of the 2016-17 year-end financial statements, an audit report on internal controls, and a quarterly report addressing risk management. The committee reviewed the Internal Audit Enterprise and Risk Management Department plan. The plan is a 3-year rolling plan that is aligned with the AHS strategic priorities, key risks, and the health plan. The plan outlines the internal audit and enterprise risk management audit and advisory projects to be conducted over the next 3 years. It also includes the department's goals, strategies, performance measures, and budget. The committee recommended that the AHS board approves the 2017 to 2020 internal audit and enterprise risk management plan, which was reviewed by the board. Accordingly, I move that the Alberta Health Services Board approve the 2017 to 2020 Internal Audit and Enterprise Risk Management Department plan in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable.
Do I have a seconder? Hugh. All in favor? That's carried. Thank you.
Chief Audit Executive reports annually to the committee on the adequacy and relevance of internal audit's mandate, authority, and responsibility as defined in the Internal Audit Charter. The Charter has been revised to reflect changes in the international standards for the professional practice of internal auditing that came into effect January the 1st, 2017. The committee is responsible to recommend annually that the board approve the Internal Audit Charter. The committee reviewed the Internal Audit Charter dated April 2017 and recommended the board approve it. Therefore, I move that the Alberta Health Services Board approve the amended Internal Audit Charter, April 2017, in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable.
Thank you. Do I have a seconder? Marlis? All in favor? That's carried. Thank you, David. All right, community engagement. Brenda.
Thank you, Madam Chair. The Community Engagement Committee met on April 20th. It was a special meeting of the committee to consider for board approval draft terms of reference and bylaw for the creation of a Provincial Advisory Council on Seniors and Continuing Care. The establishment of the Provincial Advisory Council on Seniors and Continuing Care will enable greater opportunity for public, expert, and stakeholder engagement on matters relating to strategy, policy, and program development on continuing care. And this includes long-term care, supportive living, home care, palliative, and end-of-life care, and also initiatives arising from the work of the Seniors Strategic Clinical Network. The committee recommended the board approve the terms of reference and the bylaws. Accordingly, I move that the Alberta Health Services Board approve the terms of reference and bylaw of the Provincial Advisory Council on Seniors and Continuing Care in the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable, and submit the bylaw to the Minister of Health for approval.
Thank you. Seconder? You? All in favor? Carried. Thank you very much. All right. Back to you, David. Finance Committee.
Thank you, Madam Chair. The Finance Committee met this morning and all board members were in attendance. The committee received an update on the preparation of the 2017 to 2020 AHS Health Plan and Business Plan and the 2016-17 Annual Report. In addition, the committee discussed matters with respect to the 2016-2017 financial statements. There were no items considered by the committee for board approval.
Thank you. With that, I move the meeting be adjourned.